Gen NCLEX RN video based on care for patients with cardiac disorders. Cardiac disorders include coronary artery disease, infective endocarditis, myocarditis, pericarditis, valvular disease, and heart failure. A patient returning from heart catheterization has a slight increase in serum creatinine from 1 to 1.2 mg per dl and a blood urea nitrogen of 30 mg per dl. Previously, it was 22 mg per dl. The nurse anticipates an order for which medication? Nitroglycerin, IV hydration, dialysis, furosemide. You know that for cardiac catheterization, a contrast agent is being induced. This contrast will result in nephropathy. Contrast-induced nephropathy is a potential complication of the heart catheterization. It is evidenced by increase in serum creatinine and BUN levels. Hydration will flush out the dye. Hence, IV hydration is the order which nurse needs to anticipate. Lasix will remove the fluid and it will increase the problem when fluid is lost from the body. What order should a nurse anticipate when caring for an heart failure patient with cold extremities, poor mentation, hypotension, and no urine output? Diuretics, afterload reducer, beta blocker, inotropic support. Patient is experiencing decompensated heart failure and requires inotropic support to improve the contraction and thus increase the cardiac output. More aggressive treatment is this at this point is this inotropic support. The patient needs to get diuretics, afterload reducer and beta blockers also. The nurse is screening patient for the risk of developing infective endocarditis. Patients abusing IV drugs are at greater risk for which condition? Right-sided IE with pulmonary valve involvement, left-sided IE with mitral valve involvement, left-sided IE with an aortic valve involvement, right-sided IE with tricuspid valve involvement. Infective endocarditis is an infection of the innermost layer of the heart, most typically affecting the valves. Drugs are injected into the venous circulation. This results mostly in this infective endocarditis. The first valve encountered is the tricuspid valve, and thus the common infection site of this microorganism will be right-sided IE with tricuspid valve involvement. The nurse understands which of the following treatment plans may be considered for a newly admitted 65-year-old patient with aortic stenosis who is considered a poor surgical risk. Valve replacement, valvuloplasty, annuloplasty, commissurotomy. So here if you are seeing this valve replacement, annuloplasty and commissurotomy, they require surgery. Here the patient is considered as a poor surgical risk. So valvuloplasty is a percutaneous procedure and which has got a lower risk. The nurse is caring for a patient post-emergent pericardiocentesis for pleural effusion. A drain was left in post-procedure but has stopped draining. Which of the following actions should the nurse plan to take first? Irrigate the drain, clamp the drain, check vital signs, call for immediate assistance. Irrigating the drain is contraindicated because it can result in infectious risk, and clamping is contraindicated because it will worsen the matter by cutting off the ability to drain. We need to call for assistance, but the main thing we need to do is to check for the vital signs. After a percutaneous coronary angioplasty, what assessment should the most concern for the nurse? Back discomfort, chest pain, capillary refill less than 3 seconds, hypoactive bowel sounds. Chest pain may indicate the vessel has reoccluded. Back pain might be the result of the positioning for the procedure, but it is not indicating a new problem. And also capillary refill is good. Hypoactive bowel movements are not related to this percutaneous coronary angioplasty. The nurse determines which patient is at greatest risk for developing IE. A 22-year-old student undergoing a dental procedure, a 35-year-old man with a past medical history of IV drug use, a 65-year-old male heart transplant patient on immunosuppressive therapy undergoing a colonoscopy, a 70-year-old female with heart failure with an intravascular access device from home drug infusion. So here the answer is 65-year-old male heart transplant patient on immunosuppressive therapy undergoing a colonoscopy will have more risk for developing IE, and the minimal risk will be for among all these patients is the patient A. Which order would the nurse question in the initial management of acute pericarditis? Aspirin, colchicine, prednisolone, NSAIDs. So this aspirin, colchicine and non-steroidal anti-inflammatory drugs are the first line of management. Prednisone would only be added if the first line agents were not effective. So in the initial management it is not required. The nurse hears a loud systolic murmur at the second intercostal space right sternal border. What valve problem is the patient likely experiencing? Aortic regurgitation, aortic stenosis, pericarditis, infective endocarditis. So here the patient is experiencing aortic stenosis. The systolic murmur at the second intercostal space at the right sternal border, that shows aortic stenosis. Aortic regurgitation is a diastolic murmur and it is heard at the third intercostal space. Then pericarditis produces audible friction rub. Infective endocarditis produces a turbulent murmur that varies depending on the valve involved. What assessment would the nurse identify as a hallmark finding of left-sided heart failure? Ascites, bradycardia, crackles, edema. The answer is crackles. For this you need to know the difference between the left-sided heart failure assessment and right-sided heart failure assessment. What are the clinical features you will be observing? In the right-sided heart failure, there will be a jugular venous distension, dependent edema, hepatomegaly, ascites. In the left-sided heart failure, there will be shortness of breath or dyspnea or orthopnea, crackles on auscultation. So this was what asked in the previous question. Pale color, weak pulses, cool temperature in the extremities, delayed capillary refill, fatigue and weakness. Thompson is a 57-year-old man with no significant past medical history except high BP. He was non-adherent with his medications. He reports feeling short of breath and fatigue unrelated to physical activity. Over the past 3 weeks, his symptoms have progressed. On physical examination, he is lying in bed with head of the bed in a semi-follows position. He is afebrile. Temperature is 97.7 degree Fahrenheit. Blood pressure is 185 by 102 mm of Hg. Heart rate is 124 beats per minute and appears to be irregular on the monitor. His respirations are 40 per minute and labored. Auscultation of his lung field reveals crackles throughout. At a 30-degree angle, his jugular vein is distended and measures at 5 cm above the sternal border. He is on oxygen at 4 liters per minute via nasal cannula with an oxygen saturation of 95%. He has significant pitting edema of the lower extremities. Capillary refill is decreased to the fingers and his extremities are cool to touch. ECG reveals atrial fibrillation with a heart rate of 130 to 140 beats per minute. Blood pressure continues to be high at 185-102 mmHg. The results of the diagnostic test reveals chest X-ray indicating left ventricular hypertrophy. A transthoracic echocardiogram indicates an ejection fraction of 30%. Cardiac biomarkers are negative for ischemia with troponin 1 less than 0.1 nanogram per ml. Renal function test reveal borderline failure with a creatinine of 1.5 mg per dl and a blood urea nitrogen of 30 mg per dl. BNP value is elevated to 500 pg per ml. Brain natriuretic peptide. Serum electrolytes reveal elevated potassium at 6 milliequivalents per liter. It is determined that Mr. Thompson is in heart failure and he begins treatment. A diuretic is administered, an ACE inhibitor and a beta blocker are ordered. His shortness of breath and color begin to improve. His transient chest pain resolves with treatment. So this is what has happened with the patient. The nurse has received the following orders for Mr. Thompson. Which order should the nurse implement first? The patient has got a heart failure. Furosemide 40 mg IV. Insert a Foley catheter, low sodium, low fat diet, apply sequential compression device. So the first order which the nurse need to do is to administer furosemide. The patient is tachypneic with labored breathing. So when we are administering furosemide or Lasix, it will reduce the fluid overlap and thus it will decrease the respiratory distress. Airway and breathing is the priority. That is the first point you need to consider. We need to monitor IO chart. So Foley's catheter is required. Low sodium diet should be maintained. Low fat diet should be maintained. And a compression device also has to be given to the patient. But it is not the first thing which is to be done. The nurse correlates which finding with Mr. Thompson's atrial fibrillation with a heart rate of 120 to 140 beats per minute. Acute decompensation requiring immediate cardioversion, loss of atrial kick requiring fluid resuscitation, increased workload of heart requiring beta blockers, cardiac ischemia requiring immediate cardiac catheterization. So here, for this atrial fibrillation of this patient, there is an increased workload of the heart requiring beta blockers. Increased heart rate by itself does not indicate acute decompensation, the need for fluid or cardiac ischemia. One would also evaluate BP and cardiac biomarkers, but we do not know elevated heart rate increase oxygen consumption and increase the workload of the heart. Rate can be controlled with beta blockers, so it is indicated. The nurse understands Mr. Thompson's sublingual nitroglycerin decreases the chest pain through which mechanism of action? Dilating the coronary arteries to improve the blood flow, decreasing the preload to relieve symptoms of dyspnea, decreasing the heart rate to decrease the cardiac workload, converting atrial fibrillation into sinus rhythm. Sublingual nitroglycerin dilate the coronary arteries to improve the blood flow. So thus it will be reducing the chest pain. Which statement by Mr. Thompson indicates that teaching about hyperkalemia has been effective? The water pill makes my potassium level high. I would eat banana because they make my potassium go down. My liver is not working, so it holds on to the potassium. My kidneys are not working, which makes my potassium high. Here, the correct answer is my kidneys are not working, which makes my potassium high. All other three options are wrong. The nurse providing care for Mr. Thompson should include which of the following in the discharge teaching plan? Select all that apply. Sodium restriction, daily weight, medication teaching, vigorous daily exercise, carbohydrate counting. Sodium restriction should be there. Daily weight should be checked and it should be maintained. Medication teaching should be done to the patient. The patient should not go for a vigorous exercise. The patient should be doing a light or moderate exercise, and for diabetes patient only, carbohydrate counting to be done. Hope you understood this video. Thank you so much.